Maybe Brigitte has something to do with this.
We're waiting for her. No.
Now we are live, and I am not muted anymore. Hello, everyone. Good afternoon and good morning. Welcome to the second session of the online series of the eHealth Security Conference. The conference is organized in cooperation with the Danish Health Data Authority. Normally, the event would have taken place physically. The current circumstances transformed this physical conference into a virtual one, respecting traveling restrictions but also public health. I am Dimitra Liveri. I am a network and information security expert at ENISA, the European Cybersecurity Agency, and I will be the co-hostess for today. Together with me is Ms. Krista Wolf-Sharby, a cyber and information security coordinator at the Danish Health Data Authority. We will be the hostess for the hosting. We will do the hosting for the day.
Hi.
So before presenting the topic of today's session, and of course our esteemed panelists, we would like to share with you some housekeeping rules. The virtual session is broadcasted via the ENISA YouTube channel. You are kindly invited to share your views and raise any questions that you have to the panelists through the YouTube channel, the YouTube comments functionality. Please note that any inappropriate or insulting comment will be automatically eliminated. However, this is an interactive session, so we urge you to join the discussion and share your views with the panel. The session today will focus on cybersecurity for COVID-19 tracing apps. In the early days of the crisis, it became evident that mobile applications can help health authorities at national and EU level in monitoring and containing the spread of COVID-19. Since since the declaration as the pandemic, many countries have launched similar apps. I don't have a COVID, but I am sick. I have a bit of flu. So, at the same time, numerous concerns regarding cybersecurity and data privacy were raised. In this panel today, we will discuss these issues with representatives from the member states, from organizations related to the development of these national applications, but also with the European Commission. For those who are not aware, the European Commission, in collaboration with national healthcare authorities, has released last spring the EU toolbox, including recommendations on the applications for contact tracing. Our keynote speaker, Mr. Christian de Cunha, policy officer at the Cybersecurity and Digital Privacy Unit from DG Connect, will share more insights from this endeavor that was undertaken by the European Commission and the member states. So let me welcome Christian de Cunha, who will give the keynote speech.
Well, hello, good afternoon. Thank you, Dimitra and Evangelos and Krista for the invitation to join you. It's a great pleasure. So I'm going to talk to you about where we are with the contact tracing apps in the EU, and give an overview, of course, because it's our colleagues who will be speaking later who've been doing the really hard work of actually developing and launching the apps on the national stage. But I'll give an overview of the policy framework around it, and also of the the criteria that we applied, the principles that we applied on cybersecurity, but also other related aspects such as privacy, and I'll offer some very tentative lessons learned so far of this whole endeavour. So if I could just turn to the next slide. We have covered most of the map of the EU with contact tracing apps, which is an extraordinary achievement, because 6 months ago there might have been maybe one or two colours on this map, and now it's almost every EU member state which has launched or is about to launch an app to support contact tracing. So I'm going to give you an overview of the different apps which are out there. As you can see from the map, most of them are taking a particular approach in terms of architecture and design. And if you could go to the next slide, please. We have, in effect, two different types of apps, two approaches, both of which are entirely consistent with the common toolbox, which I'll come on to in a moment, and which was mentioned by Dimitra, decentralized and centralized. Now, I'm sure some of you listening are great experts in this, but for those who aren't, the decentralized approach involves most of the data being processed and staying on the device itself. And when a person indicates that they have been tested positive for the virus, then the keys that they have been broadcasting over the previous 14 days are then uploaded to a server, which is then which are then distributed to the other users of that app, so that they can see if it matches the signals that they've been detecting over the previous 14 days. And if the app detects that they may have been exposed to the virus, then they get a notification. With the centralized architecture, this matching is done on a central server rather than on the device itself. But also, it's a different key which is shared with the server from the app of the person who has said that they have tested positive. So instead of uploading the keys that you yourself have been broadcasting as a user, you will be uploading the keys of the contacts that you've received from moving around in the previous 14 days. So they're quite different, and they're quite distinct, and I'll come on to why it is that the majority of them the majority of member states have gone for decentralized architectures. As you can see, there are 17 already live and out there, and there are 4 more under development. And already there are 3 which are linked via the gateway, and so they're interoperable. If you go to the next slide. It's interesting to see how quickly we've moved on this. It's quite remarkable. In 7 months, we've gone from a very frantic phase where we were trying to find technological solutions for the crisis, the unprecedented crisis that we found ourselves in back in March, to a picture which is now one of great convergence on an EU scale in terms of the use of these apps. So a key moment back in March was when Singapore launched their Trace Together app, where one of the insights that came out of that was that actually there is no need to track someone's location if you're trying to support the work of health authorities in containing the virus. It doesn't matter where you are, it matters who you've been in contact with. And so it was that insight which then led to various developments on the academic side with DP3T. We, as the Commission and the Member States, at the same time, came up with, first of all, a recommendation and then a toolbox, setting out some general parameters for how these contact tracing apps should look. And at the same time, the EDPB, the Data Protection Authority, has published guidance on, from a data protection and privacy perspective, on what should and shouldn't be done in these exceptional circumstances. What was particularly interesting about their intervention was that they were saying that privacy as such is not an obstacle to the processing of data to combat a public health emergency. In fact, it is envisaged explicitly in the GDPR that this would need to be done. But of course, there are questions of necessity and proportionality which need to be taken into account whenever you're developing an app which will be processing potentially sensitive data. Since that moment in April, there's been a growth in the number of member states who've had conversations internally and have decided to develop their own apps and to launch them. There were, right at the beginning, I think it was just Austria and Norway. There was an important point towards the end of April when the German government announced that they were going to be following a decentralized approach, because around about that time it was still, I suppose, 50-50. Some member states were attracted to the centralized approach and others to the decentralized. In parallel to all of this, there was an unexpected intervention by Apple and Google. Of course, I think 99% of devices, smartphones which are used in Europe, are run on either iOS or Android mobile operating system. Apple and Google in April announced that they were going to launch APIs which would support a particular type of architecture, the decentralized architecture, and that was clearly a big factor in a lot of decisions on a national level, because it meant that by developing an app which was compatible with the APIs, you wouldn't run the risk of the battery on your phone depleting, and that the Bluetooth technology could run in the background. So since then, we've had a progress report in June when we had 10 national apps which were live, and now we have 17. And the most recent development has been the launch of the European Federation Gateway Service, which is a solution developed by the member states with our support for connecting the different apps. There is no single European app, but in theory, if all of them are linked to the gateway, it would be as if you had a single European app, but with the necessary national characteristics that you would expect as an individual user. And we have 50 million app downloads according to the latest statistics. If I could go to the next slide, please. So this is the state of play, 50 million downloads. The gateway has been launched. There are 3 apps which are currently linked, and others are going to follow very soon. We're working with the WHO and the European Centre for Disease Control on evaluation criteria. And it is truly a remarkable exercise in EU solidarity. The people who are going to be speaking shortly after me are the ones who have been able to, with enormous commitment and investment of energy, over 80 coordination meetings since March, to unite around a common solution. And this is something that will not be just for this particular crisis, but it will be able to be reactivated for future pandemics or public health crises which require a similar digital intervention. Next slide, please. One of the earliest things that was a concern, not only from a privacy perspective back in March and April, was that the pandemic would be used as an excuse to introduce a level of surveillance which would be harmful or disproportionate. And so there were some very intense discussions that we had at the time about putting guardrails around what we wanted to do as a community, as the EU, in the area of contact tracing apps. And those criteria were that it should be the public health authorities that was accountable and responsible for the apps, that it wouldn't just be a wild west of apps which were proliferating in the App Store, that they wouldn't exclude, they wouldn't result in further digital exclusion. Of course, not everybody has a smartphone, not everybody is comfortable downloading apps onto their smartphone, that it would be temporary and voluntary. The interesting thing in Singapore, going back to March, is that it's now compulsory either to have a Trace Together app or to have a separate device which has contact tracing functionality. The data would be minimized, no location tracking, and that there would be cybersecurity standards, which I'll come on to just now. And also that there would be safeguards against stigmatization. There was a great concern that people who were who indicated they had got the virus or that they had the virus, that they would suffer stigmatization, and we didn't want the technology to be creating that risk. Next slide, please. So just a quick overview of how interoperability works. I'm not going to go into the technical details, but basically it works if your app is plugged into, if it's participating in the gateway, then it will work just as if everyone was using the same app. And so you will be notified if someone using another app has tested positive and you've been in contact with them. The details, or further details about this, are available on the Commission website, and the link is on the final slide of this slide deck. Next slide, please. Just an overview of the cybersecurity standards that we applied from the very beginning, and it was ENISA themselves who were advising us and who drafted the annex to the toolbox, which set out the common cybersecurity standards that should be applied by the member states in developing their own apps, that there should be national risk assessments, that there should be encryption for all communication between the app on your device and the back-end server controlled by the Public Health Authority, that the default setting should be secure, particularly for those who are less technically capable of manipulating their phones, that it should use appropriate user authentication available on the operating systems, and also that the source code should be accessible to independent audits, to independent experts and coders to examine. And we've done a full risk assessment as well for the gateway itself, which is in effect a piece of software, a server, which is hosted by the European Commission in Luxembourg, and we've identified a number of risks. None of them are high risks, and we're managing them carefully. On to the next slide. Just to conclude then with some final thoughts. I mean, this is it feels like a lifetime since March, on a personal and a professional level, but this really is just the beginning, and we haven't seen what the effect or the impact of these apps has been, and we probably will not for a while. We're now in the middle of, or hopefully at the peak, or at the heart of a second wave, and we're going to have to see how what role the apps are going to play. Evaluation is necessary for any measure that affects rights. That's clear from the jurisprudence of the European Court of Justice, and that's why we're identifying common metrics that we can use to assess the effectiveness of these apps. What I would say as a final thing is that this is in effect a carefully controlled experiment. We don't know if it's going to work. You know, Bluetooth technology is not perfect. It was not designed with contact tracing apps in mind, and so we're seeing how it works. But what we have managed to do collectively as the EU is to minimize the risk, to minimize the amount of personal data which is processed, and at a very reasonable cost. One member state I won't mention which one, has told me that it costs less than €1 per person per head of population in that member state to deliver this app, which is pretty good. And one thing that struck me was from you'll see there, this is an excerpt from Netpolitik, from a blog. These are activists that may be familiar to you, and they're very critical and skeptical about interventions which may have an impact on civil rights. And in effect, what they're saying is, if you're prepared to have Facebook and WhatsApp and other apps on your phones, which are collecting all sorts of data and you don't know what they're doing with it, then really there is no excuse not to have one of these approved contact tracing apps on your phones, because they're collecting much less data and everything is transparent and on the table. So with that, thank you very much, and I look forward to the discussion.
Thank you so much, Christian, for the intervention. I would like now to pass the floor to our moderator for the day, Dr. Evangelos Zouzounis. He's the head of the Secure Infrastructures and Services Unit. Vangelis will present the panel. So, Vangelis, the floor is yours.
Thank you, Dimitra. So I'm the moderator, as Dimitra said, so welcome also from my side. It's a very nice, beautiful Friday. I know that you are very eager to leave the office or, disconnect and go home. But before you do that, consider, the importance of this panel and the fact that we're going to have a very interesting discussion. So I have today with me a very interesting set of panelists, people with very good experience and knowledge of the subject. So in addition to Christian de Cunha, who from the Commission, who has already presented, the keynote speaker and is going to be in this panel, I have also Dr. Tina Truxius from BSI, from the German Federal Office for Information Security. BSI has done a lot of interesting work in this area. So welcome, Dina. I have also with me Brigitte Drews, Head of Division at Danish Patient Safety Authority. So Brigitte, thank you for joining. She's also a co-organizer of this event, and it was a great pleasure, collaborating with Brigitte and the institution. We have, of course, Eva Ilves. Sorry if I pronounce your names, not in the right way. I will use your first names, to make things simpler. Eva is advisor to the President of Latvia on digital policy and information technology. So welcome, Eva, as well. And then I have Dirk Wilhelm van Hulik, expert for Dutch Ministry of Health, and is the owner of Web Waving, so member of the Apache Software Foundation. So welcome, Dirk. So this is our panel for today, and thanks a lot for joining us. So maybe in order to somehow break the ice and give the opportunity to the people to understand who you are and what you are stand for, I give you, each one of you the floor for 5 minutes to do a round and present, yourselves and explain, how do you see this topic that Christian has set up. So I start, with the ladies as a matter of courtesy, and if you don't mind, with the organizers. So Krista and Brigitte.
Yes, thank you so much. Well, as Dimitra already introduced me, but again, I'm Krista, and I work as a coordinator, program lead. We have a strategy, especially for the health sector in Denmark, and we are working on all the projects concerning the strategy, and working together, for example, with ENISA, because we think that it's very important to share information across borders, not only inside our country, but also across, because that can give us a lot of knowledge. We have the same problems, so we benefit very much for this. So it's a pleasure to be working together with ENISA on these 3 webinars.
Thank you, Krista. Something particularly for the topic today?
Well, as a citizen, I think it's very interesting to see the mobile apps, and I think it's very interesting to see how they work in different countries and what are the perspectives. So today that would be my perspective, also to be here as a citizen, because there are many opinions about the mobile apps, and I think that's a really interesting perspective.
Thank you. Excellent. So then I move to Brigitte, who is the panelist and also co-organizer. So Brigitte,
hello.
I know you are coming from a meeting and you are a little bit stressed, so please relax, take your time, So
yes. Well, thank you very much for inviting me, and I'm very honored to be to join my esteemed colleagues on this panel. My involvement has been the Danish Patient Safety Authority is responsible for the contact tracing in Denmark regarding COVID, both the manual and the mobile app. So we're very much looking at it from a combined perspective, saying how do we make sure that manual contact tracing works together with the app and complement each other. I have a background in information security, so that's been a great benefit regarding the app, because there's been a lot of dialogue saying what is the proper strategy and architecture, and how do we ensure privacy by design. We actually ended up building 2 apps like other countries, that we started off with a centralized mindset, and then Google and Apple introduced the API very early on in the project, and we switched technology. And I think a lot of countries have been on that journey. And I think my primary take home regarding the app, that a lot of people actually see the mobile tracing apps as health IT. And I think a lot of the logic that has been and the discussions going on regarding the apps actually shows that this is not health IT. This is citizen IT, because it's something that a lot of people who hopefully will not get infected with COVID use as a preventative measure. But it's subject to a certain logic that's different from when we normally discuss how do we build health IT systems and share information regarding patients. The app is actually very much an app that shares that handles information about non-infected people, and in order to reduce the number of patients. So that has been a change of mindset that we had very early on in the project, but has been necessary. And because it's such new technology, we are learning new stuff every day. I think
well, absolutely. Who would ever imagine, Brigitte, last year around this time, that 1 year later we are going to talk about this topic, honestly. So, and life happens, when you plan.
Yeah, exactly.
So this is exactly what is happening today. And thank you very much, for joining. So I'll pass the floor to the next lady of this panel today. So Dina, the floor is yours if you are with us.
Yeah, thank you very much. I hope you can see me. Thank you very much for the kind invitation and that I'm allowed to participate today's panel in this eHealth security conference. My name is Dina Truxius. I'm working for the Federal Office for Information Security in Germany. We are located in Bonn. We were founded by law in 1991, so next year we'll become 30. So cybersecurity is very special, I think, in Germany, and I would like to tell you first something about that. So basically the BSI, the Federal Office for Information Security, my employer, is the German Cybersecurity Authority and is under the authority of the Ministry of the Interior. So apart from the other panelists, I guess, so I'm not working for a health institution or a health authority, but for a cybersecurity authority. And usually I entertain myself with medical device cybersecurity, but I was also a member of the internal Corona Warning App Task Force. I went through different ideas, approaches, and we encountered really we heard the need that we had to immediately build a secure solution that covers IT security and privacy. So I was involved from the beginning on, and I'm still involved to share this non-secret with you. And so today I will talk about our security or our warning app, and that we achieved the highest possible level of IT security and privacy with our app, that we are now connected to the EFGS, so the gateway service, the European. And what I will also talk about is what we actually did. So the BSI, my employer, is continuously pen testing the front end and also the back end, and we are advising with a security concept. So what we basically did is we did not so we were not responsible for the advertisement and the rollout, and we are not the commissioners of this app, but we did all the security assessments in terms of IT security and data protection that are possible, and we are still doing that. So that is my contribution to the Corona Warning app, and I'm looking really forward to discuss with you all. Thank you.
Thank you, Dina. So thanks a lot. I appreciate that. So we look forward, to your contribution and to the discussion today. So I will now move to the next lady of this panel. So Eva, the floor is yours. Are you with us?
Yes, hi everyone, and thanks for invitation, and thanks ENISA and your Danish colleagues for putting up the discussion. It must be a challenging thing, like for example, to have a debate, structured debate, and actually thinking while the crisis is ongoing. And I clearly see it very well this week in Latvia, because it's another peak week here. So the COVID is hitting actually the record high numbers for us, because we were very lucky in a spring, or sort of better organized, or for whatever reason. So it is a challenge, sort of already kind of think and introduce new solutions while you kind of have to work as a fire brigade and actually take care of crisis. So my name is Eva Ilves, and I'm working with the President of Latvia. I'm an advisor on digital policy, as I was introduced. I used to work on cybersecurity in my previous capacity and have been part of ENISA work, a great work at ENISA. My role in the app was related from the very early days when the idea came up, and as Christian mentioned, we actually were one of the early also states who considered this approach early, as we started to look at Singapore and other sort of options around the world, and we developed the app basically in parallel as Google and Apple announced, and as we learned from others what's been applied and what would be a possibility. The app in Latvia was developed as an initiative from private sector, and President's office, in my person and in a few other colleagues, actually played the role to bridging this idea into policy level to the state institutions, because the government, the prime minister and the ministries were more like an executive levels, and were really busy to actually consider new tools or new ways of how to handle crisis. They really had to handle that crisis on the spot, and there was no time. And then on the other hand, the president of Latvia himself is very up for modernization. On the other hand, he's a lawyer. He's a former judge of European Court of Justice. So he had also very high on his agenda privacy and safety or security of how people use technologies. So he really wanted to make sure that the project or anything new that he would support, or he would support new approach that Latvia uses modern technologies in solving crisis, that there is a very sort of the privacy and security is embedded and taken care. So we played that role between the private initiative, which was developed completely and built by companies, putting together an effort, signing up a memorandum of behavior of general principles and privacy respects and all the other things, and then coming to the life actually really early, I think, together with the Swiss team who also tested at the same time. We kind of worked in parallel with Google and Apple as they were developing framework itself. We kind of worked to develop the app to deploy it as early as it would be possible. In regards of today's discussion, I find the privacy question really interesting and challenging. The colleagues from Denmark already mentioned that, like every country, we discussed multiple scenarios, how that app should be working, how would it fit the best, how would it help the best epidemiologists who actually do need data and information, and then how we would earn the trust of people to use it voluntarily and not sort of being afraid of losing privacy or be followed and or surveilled. So I found these challenges really interesting. We had a lot of internal debates. There was a debate even among tech people who would design the solution, but also on a policy level. So I think there's a lot we will still learn from this app as we go. And I hope that this can be something really substantial, rather small project, but substantial product to learn from in a future way, how we can actually apply technology in public domain, especially like in the health sector.
So thank you, Eva. So indeed, you know, he's a good friend for many, many years. She was following up the work of ENISA, and she was contributing, you know, to us through different bodies. So thanks for joining us. It's time now to move to the gentleman, you know, of this panel. So I have the pleasure, you know, to introduce Dirk Wilhelm von Gulich. So Dirk, if you can say a few things from your side as well with regards to today's panel.
Yes, yeah, thank you very much. So the history in the Netherlands and also my involvement is a bit different than in most countries, because Dutch society as a whole was very critical and very worried about this. It was almost kind of like a perfect storm of our history through the world wars, the laws on privacy, the thought leaders on and their thoughts on privacy. The distrust of big tech, which is brewing in society. So these things sort of like came together, and a large group of critical people sort of like mass appeared in Dutch society. People basically also like making their own versions based on DP3T, which I did as well. And as that sort of like process sort of like matured, basically what the Dutch government did is that rather than sort of like neutralize these people with their criticisms and sort of like farm it out to a big company or do it entirely in-house, they decided to sort of like basically rope in the sort of like most vocal people, the most critical people essentially, and sort of like give them carte blanche to essentially write and build the right thing. And that for me, sort of like that, and basically for me that was sort of like in many ways was a wonderful thing, because sort of like in the sort of like late mid 80s, early 90s, I started my career at the European Commission at a research lab in Italy, and more or less sort of the same thing happened there as well. We had the first Apache web server, we started internet engineering, but there was absolutely no security, absolutely no privacy. We had cookie wars going on with the US, and sort of like there was essentially the room in an open standard, open source sort of way to actually build, sort of like the right security and technology. And that's exactly sort of like the same sort of role I've basically been bringing to the project here in the Netherlands, is sort of like helping sort of like engineer that security, that safety, and not just technically, but also kind of like from a data minimization perspective, consider governance, consider trust, consider sort of like all the things sort of like outside your sort of like normal, like non-technical space, to sort of like basically get all of those things absolutely right. And in parallel, sort of like as a sort of like a confessed open source person, so like from the Apache Software, one of the founders of the Apache Software Foundation, we also basically in the Netherlands made the entire effort entirely 100% open source from day one. So every line of software was not only published, but we actively engaged hundreds of people in Dutch society to contribute, and not just translations or non-technical things, but actual code, actual real sort of like improvements, comments on our architecture, things like that. And sort of like basically that was sort of like then developed in a very sort of like open process. And in fact, even today, there is nothing secret in our infrastructure essentially. So any Dutch citizen in theory, if Apple or Google would let them, can actually sort of like build the app. There are no secrets hard coded. Basically everything is entirely sort of like in the open. Where sort of like now is essentially that all of that is up and running. It's working well in society. We're seeing a very, very good uptake. We're also seeing that the app works. We're seeing sort of like a slanted effect of the app. So people kind of like use the app and call the sort of like the public health authorities because they got a warning from the app, are actually tested more often positive. So actually there's a very sort of like positive thing happening. And right now, sort of like our main focus on the engineering team is making sure that we sort of like get the EU federated gateway going, which by the way isn't in the Netherlands as much of a technical effort because we're sort of like fairly far there. It's also kind of like making sure that these things pass muster from a legal perspective, from a law perspective, because the Netherlands is not a consent-based country. We actually had to change the law and actually had Parliament sort of like pass these things, which obviously sort of like these processes take time.
So thank you, Dirk. That was quite elaborated. I hope you still have the passion, for the next topics of our discussion, So please remain energetic as you are now. And the last member of the panel is Christian. You saw Christian already, as a keynote speaker. So Christian, maybe you would like to say something more in addition to the keynote. So about yourself, about the institution that you work for, the work that you are doing there, very briefly. Christian, do you hear us? We cannot hear you. Maybe you are muted.
Is that better? Yeah.
Yes, much better.
No, I said you probably heard enough from me already, but the funny thing was I joined DG Connect like 2 weeks before the lockdown. So these apps took over my life for about 2 weeks, two months. It was very intense. I'm in the cybersecurity and digital privacy unit. So we work with ENISA a lot on cybersecurity, and I'm actually now spending a lot of time developing a new cybersecurity strategy, which the Commission is planning to publish at the end of the year. But yeah, I mean, the contact tracing apps have been a very it's been a very profound experience, I think, for everyone in the Commission to see how in an area like public health where the EU has very limited competence, it's basically the member states who are nationally accountable to their citizens for managing public health crises. But we've been able to contribute and to help coordinate the effort, and given that it's an IT project, and that it's come together so quickly, we've never done anything like this before. I think it's something that we can be encouraged by, all of us, and also something that will, as I said earlier, it's not just for this current crisis. It could be we're laying the foundations for something potentially very valuable in the future. People are starting to ask whether or not these apps are making a big difference. As I said, I think it's still too early to say, but there are indications. For example, one of the head of the Chancellery, I think in the federal government of Germany, said last week that there were something like 10,000. Dina may be able to corroborate this, but there were something like 10,000 people who had been alerted by the app and were then able to take appropriate response, including alerting their own contacts. And those were users of the apps. And so even if we don't have any hard statistics, the fact that someone getting a notification from being in proximity to someone with the virus is something that would not happen without the app. It certainly, manual contact tracing relies on human recognition and memory. And so the potential for this app to make a big difference is considerable, but we wait and see. We wait and see what happens.
Okay, thank you, Christian. So we have prepared, with Dimitra, a couple of questions, for the panel to warm up a little bit. And please, the audience, the people who follow, don't miss the opportunity to interact. Send your questions, to the chat, and Dimitra will find a way to channel them to me. And we look forward also to the input from the audience. So the first question, guys, is how does a coronavirus tracing and warming up work? And what kind of data is shared actually? What is the difference between case investigation and contact tracing? So if I may ask, first Dirk and then Dina for an answer, please.
So in the Netherlands, we've selected for a very bare bones, very minimal contact tracing app. So the Dutch app has basically functions entirely sort of like standalone in the field, making use of the Apple Google framework, where it listens to the broadcasts of other phones and it receives the broadcasts of other phones. And what it sends out and what it receives are essentially sort of like random numbers, which have no information about what's happening. Once basically someone is found infected, once someone has had a test by our official public health services, we ask in the sort of like conversation you then have about basically the tracing research to this patient, like, are you using the app by any chance? And if the person says yes, then we ask, would you mind us having these keys of your phone so we can distribute the keys you've been broadcasting the last so many days to other people? And we actually take into account the date of onset of the symptoms. And then we essentially publish that set of random numbers to the entire Dutch population. And there basically then their phones can pick this up and each phone can figure out, have I ever heard any of those codes myself? And if you have, and you have heard them for longer than 15 minutes and the signal strength was sufficient, you've probably been longer than 15 minutes within sort of like 1.5 meter near that person. And in that case, your phone essentially says bing. We don't know that as a central authority. We don't hear that. Just your phone says bing, like you have been potentially near someone who was tested to be infected by the public health services on that and that date. And then we of course give some general advice what you should do. And one of the options there is, and sometimes recommended depending on your personal circumstances, is to call the health authorities and basically sort of like discuss the situation with them. And then essentially sort of like you go through the testing system if that's required. And once you've been tested positive, the whole circle essentially sort of like starts again. So in the Netherlands, basically that whole app essentially functions completely separate from the public healthcare system, because once you're in the public healthcare system itself, sort of like in the normal contact tracing research, the situation with regard to privacy is the opposite. You basically have virtually no privacy, and you will be asked everything. Where have you been? What church have you gone to? And every personal question you can imagine. So these are essentially sort of like two separate worlds for us.
Very good, Dirk. So thanks a lot. Dina, what is the proposed approach in Germany with regards to data sharing?
Yeah, thank you very much. I can just endorse with Dirk and also with Christian. So as you have already heard, we initially had the idea of a centralized system, but we switched to a decentralized system. And as said by Christian, suddenly there was this exposure notification framework from Google and Apple provided. So Germany has built an app that has currently more than 19 million downloads. That means in numbers, more than 20% of the German total citizens are covered with the app, so they have installed the app. And what I can also tell you, within the first 100 days, we exchanged 1.2 million results. And I think even, so I said in June, we released our app, and I think already 1 week after, don't name me on that exactly, but I think one week after, we already had the first key exchanges, and we could see that the app is running. From my personal perspective, I also had some low-risk encounters, and this is exactly what our app is doing. So we have a decentralized approach using the exposure notification framework, as Dirk already introduced, and our app measures the distance and the duration of digital encounters. We are exchanging random Bluetooth IDs. There are some other security features implemented, like, for example, that you cannot locate people, even those who are sending positive results to the backend. So when you send positive results, so even when we're talking about a decentralized approach, you need a backend. And you need that particular backend in case you are infected and you want to notify other people around you. So you share your keys with the appropriate backend, and then this information goes to all people who had enough contact with you to collect your ID numbers. And as I said, I'm responsible for IT security and not in the health ministry or Robert Koch Institute. So they set they formulate the constraints and the requirements. How long do you need? How long does an encounter has to take, and what is the distance between people? So this is how they set it. And as I said, we don't have a location info. We have a completely open source development we are continuously testing. The same applies to us. Every German, Dutch, or European or even US citizen can in principle look at the source code and comment on what we are doing. And moreover, so our app was then primarily designed with the Deutsche Telekom AG and SAP, and also with the other authorities I already mentioned. And regarding the Federation Gateway Service, you can just imagine all our national backends from the decentralized systems, like in Germany, they are now functioning like apps and talking to the backend, which is then the European Federal Gateway Service, maybe to ease this. Thank you.
Thank you, Dina.
Yeah, and perhaps one important thing to add is that's actually something very common in Europe, that we're very concerned about that little bit of a decentralized backend we need to have. So every country has done something in terms of decoys or fake traffic to essentially hide from employers, from basically people near you, the fact that you potentially may have been infected or may have been near something. So that's actually something which is very heartening to see, that all across Europe we've sort of like found ways of doing that and sort of like basically making that part of our core solutions.
Thank you for the clarification, indeed. So, guys, I mean, your organization has been involved with the development of the COVID-19 Tracing National Mobile App. So what were the cybersecurity and data protection challenges you faced, and how did you tackle the issues? So if I can move to Brigitte and Eva.
Yes, I'm in the Ministry of Health, and when we looked at it, said we needed an app that was had the necessary efficacy in complementing the physical manual contact tracing. So we wanted to. So we have the traditional saying, okay, what's the privacy? How do we ensure the data quality, and how do we ensure the that it actually works as designed? And I think we're still the whole privacy discussion, we ended up with the decentralized solution, same as Germany and the Netherlands, and the fact that data is not shared with the central backend, but is stored locally on the phones is something that's very important, and was very important in the whole dialogue in the press and on social media. We actually established an advisory board containing people both with cybersecurity, information security, but also more datalogical, epidemiological, but also data ethics. So we have an advisory board that is kind of saying, that's a sounding board for saying, how do we as a society wish our app to function? And that has been very, very useful in the development and in the ongoing development. And we're very close to connecting to the Federal European Gateway. So there's the basic technological framework saying, how do we make sure that these data are secure and data are not compromised. From a more health perspective, there was a big discussion saying, how do we ensure the veracity of the notifications of infected status? And so we have also built a national backend. We have a tradition of having centralized repositories with health data. So we actually reuse our existing infrastructure with our national EID, so that when you're infected, you can then log in the app, say, I want to notify, but then you actually log in with your national EID, and your infected status is verified against this national repository of COVID infected, so that we don't get the false positives so that notification is actually verified in a laboratory. And then the last thing, and that's the thing that we're actually looking at now, because we have so little data about the usage, we're continually testing, saying, how do we make sure that the notifications are the correct notifications and are actually missing the and are actually sent out to the relevant people. So testing goes on, saying, are the configurations correct, and are we actually close to the manual contact tracing definition? Because we've decided that the advice people receiving a notification in the app is the same as when you're identified as a close contact in the manual contact tracing. So a notification in the app is followed. with advice to self-isolate and get yourself tested 2 times as if you were identified in the manual contact tracing.
Thank you, Brigitte. So I will ask the same question to Eva, and then, I see Dimitri, is bombarding us, with questions from panel. So maybe, first the answer from Eva, and then, we can take a couple of questions from the panel, from the audience, sorry. So Eva.
Thanks, colleagues. Thanks, colleagues already made it easy because I think a lot of that is covered. I think one of the observations, we obviously are decentralized, and I think it goes, it goes without saying, if anyone uses Google and Apple framework, then it can't be anything else because that's the precondition. And then I stand corrected if colleagues can translate it differently, but at least from our cooperation, I didn't see that as a choice in negotiations. Though we did face quite a lengthy debate with them, and that has to do something with what the Danish colleague mentioned. We tried to bring that solution as close as possible to the manual solution, which what epidemiologists do manually. And that requires the link with contact with the case, and that helps their analysis, which of course is not the way app works. But for the privacy aspect and for actually getting trust in from citizens to use it voluntarily and on board, that's sort of an important other component that sort of required quite a bit of discussion in our institutions between both developers, the requirements of Google and Apple set in their framework, and the way epidemiologists were working. So it did require a lot of reform in our side. It required also the way to introduce a new procedures in our CDC, because if we have to make this as equivalent tool to help people who do receive notification, then all these elements of procedure have to fit in an overall, how they verify that it goes along with the test and that they're able to advise. And I agree that there is still a lot of ongoing work, including of how do you make sure that notifications are correct. We do face a lot of interesting technical aspects when sort of people have been offline and offline again. And what is that timeline when the infected keys get to checked and why somebody gets notification not the same day or gets the day later. So there is a lot of I think there's a lot of details in that, but it has to do with the trust. And the way Latvia has run the app is that it is owned by Latvian CDC. And that immediately means in for public that it's verified by what Latvian state or Latvian epidemiologists are doing and saying. And so if a person receives a notification, the person has a certain expectations that national CDC, that our epidemiologists, if he or she calls up, can explain and can understand and can give advice. So there is a lot of sort of operating from a traditional analog world with an app with a very high level privacy anonymity, which is required by the same society, to make sure that we understand where it's heading, and that we can give a trustworthy advice and explanation to people. And I also think even it goes back to the question of how efficient is. In a way, we are not able to tell how much contacts have been generated. We can see because, of course, the testing in our system requires, everyone who is tested COVID positive comes to the database of CDC, but the part of how many contacts actually that has generated or how many contacts have been traced through the app is not something that we would see. We can see that the statistics that from the people who call in, and it is substantial. We can really see now this week with the peak of COVID that people call in, and we learn a lot that people been using. We have had a number of cases where people were willing to share that has a serious impact. For example, a medicine personnel who got warned by app actually did not go to the hospital, and I think that is an important notification or a moment that saved probably some more trouble. But I find this privacy and anonymity and the sort of work of analog epidemiology system something quite challenging to bridge, and the expectations from society on both ends is something that requires quite a lot of exploration and also a very thorough technical work to be able to trust the independent work of the systems. So that partly is not in our hands.
Excellent. So thanks a lot. So I'll pick one of the questions from the audience, guys, who says, what are the measures that the speakers, I mean ourselves, are recommending so that the government stays independent and does not rely on software vendors? So I see Dirk, raised his hand. So yeah, I'm happy also to have other people.
So in all honesty, in the Netherlands, it was somewhat luck that we fell on this, because in the initial sort of like approach, it was assumed that large software vendors would do this as a proprietary effort. But as the distrust in Dutch society was so incredibly high, these reviews, so we called them epitons, were actually held in public. They're actually broadcast over the internet and some even on national television, where these big software companies were being questioned, these big consulting companies were being questioned. And the results were so incredibly bad. It was so clear that these companies were sort of like, yes, they wanted the contract, but to really sort of like give privacy and security, and to really sort of like make that your first priority, that clearly wasn't in the cards there. So that actually sort of like essentially gave rise to the government sort of like being able to sort of like have this essentially commissioned and done by basically essentially its biggest sort of like internet engineer criticisms, sort of like individuals which they sort of like essentially rounded up in society. So whoever kind of like was deeply critical and very technical sort of like essentially got rounded up and sort of like volunteered for this effort. And what we actually essentially found then was that these projects then staying independent and staying essentially sort of like unreliant on open source or on source of others is simply the quality level required by society. In the Netherlands, we chose for the auditing to be done not so much by the government, although we did do those as well, but also basically by lots of outsiders, universities, companies, and other people. And this kept us so incredibly honest, and it had to sort of like forced us to pick software technology and things which were so of such a quality that essentially open standards, open source were essentially the only options sort of like left on the table, which basically meant that we sort of like sort of like these two worlds sort of like started to amplify each other, and essentially sort of like meant that basically once we're on this path, basically we're on this path for essentially for this project forever. The situation is not entirely rosy, because we are highly dependent, like everyone else, on Apple and Google. And while that worked well in the initial days, we are now seeing that the priorities are starting to diverge. There are certain things which we care deeply about in the Netherlands around, not just around security and privacy, which we'd like to fix or improve in the Google Apple protocols, but also, for example, we'd like to really sort of like get some sort of idea of how well this application is working, and what Brigitte also was saying, sort of like measuring these things and do so in a privacy preserving way. And we're sort of like finding now that essentially sort of like not having these framework, open source, open standards is really sort of like essentially sort of like hampering us as a society to sort of like do better there. So the answer to that question is sort of like it's a bit of a mixed bag, but once sort of like you honestly truly want to meet the standards that society set for privacy and for security, essentially sort of like existing software vendors simply have very little proprietary to offer. It simply isn't at that level. It basically wouldn't pass the audits.
Good. Thank you, Dirk. Thanks a lot. Any other panelists who wish to contribute on this topic? No? I see now a more personal question from... yes, please.
In Denmark, we because we started off with a centralized mindset, we picked one vendor, but so our source code is not open source at the moment, but will become it later this year. But basically, as a government, when you're building national infrastructure, you basically need to get your hands on the source code. So whether you use it whether you employ a vendor or you build it yourself or you use a community, you need to make sure that that source code is not proprietary to a specific vendor. That's just basic entering into the right contract.
Yes, yes. I have a more challenging question now for all of us. Basically, it says, so far, do you think that the deployment of the app is effective in relation to its purpose? So tackling the pandemic and protecting public health?
I can answer that one for Denmark at least. I say a resounding yes. When you look at it, saying how many people, we can actually monitor how many people notify themselves infected, and we can see that is especially now with the rising infected numbers that people are notifying themselves infected. And we can also see a rising amount of people getting tested due to notifications. We do a survey. Everyone booking a test in Denmark, they do it on one website. And we have a survey where you can voluntarily answer. There's only about a 50% reply score, but still it's a pretty sound indication. And based on those numbers, we have about a small country, but we have about 5,000 people who've said that they've been they're being tested solely due to notification, and we have around 50 people who actually are of those who are actually positive, which is, when we look at it, the positive percentage of the people notified by the app is higher than the population in general, so that there are actually infection chains being broken by the app. But we're still saying we want to drive those numbers up, and that's why we're testing and calibrating all we can do. But we've had to establish a different reporting structure because we can't get the data from the app.
So what we say actually to our audience today is that this is not a technology push. There is a way for technology to address the problem, and so far, whatever we have done, gives us a good, let's say, indication that it works and people benefit from the use of it.
It's an indication it works, and it's also and we're pushing for it to work even better. It's kind of a soundbite.
Yeah. Yes. In the Netherlands, exactly the same thing. It works and it works better. So yes, we have got the same challenge. We have to get it through reviews and through asking questions. But absolutely, the result is positive, and not only that, it's disproportionately positive.
Very good, excellent.
I can add. I can add from Latvia the same experience, yes, and I think it's more like because the peak is now up, the numbers are rising. Then we feel so. We introduced it in May already, but we didn't really see that much use or usage, and then now we see big difference. And I think on top of what already colleagues said from Denmark and Netherlands is also that we gain time. We really can see that the people get they're notified by phone, they get quicker. By the time, because we still continue the manual analog each case investigation and each case contact tracing, then we can compare that we get much faster information, or people can call back much quicker than actually that would be done manually. So it's really important also moment that we don't lose that 1 or 2 days where a person without any symptoms but being exposed could possibly already bring the virus further on.
I think the thing that we're following is very much the people who are not notified in the manual contact tracing because they're unknown contacts. So people you're next to in a bus or on a train or in a cinema. Because our general story is that, well, the app casts a wider net because it also registers contacts with people you don't personally know, but it can only monitor distance and time, and so cannot monitor the other definitions of contacts. But we can see that there are people who have not been reached by the manual contact tracing, typically because that there's no personal knowledge about the people, who are then tested positive at a higher rate than the background population. And I think that's the main reasoning for the app, because people know who they're living with, who their colleagues are, but people don't know who's the person sitting next to them on the train going to work.
Yes, absolutely correct. Tina, any reaction from your side with regards to the question? I mean, is there a good value for money for this app in Germany?
Yeah, so I think I mixed it a bit with my previous answer. So for the German app, I can just say it just works. I think it works, and the more people are installing and using the app, the more likely it is that you can break infection chains. That is just a simple calculation. But what I find interesting, I don't know how it's in the other countries. After the lockdown, we encountered some other social distancing measures, for example, not going out or booking restaurants, keeping distance, and so on and so far. And I think especially when loosening those measures and when preventing a lockdown, and I mean, we are all in a trial phase. We have never encountered such a pandemic. We have never ever built such an app, never on a European level. So it's also, I think, a test for us and to see what we can improve on. And I think for all those unknown people, what Brigitte just said, in a restaurant, in the bus, in public transport, wherever you are, you can find those people definitely more easily than with manual tracing.
Excellent. Of course, I mean, guys, let's be realistic. What this app or these apps are doing, basically is not possible for a human to do, because you move, in the society, you enter a shop, and you are not aware of the other people around you. So, of course, so if we can put technology for a good use, that's the best. Christian, from the Commission, do you have maybe a more European perspective of this question? I mean, do you have some statistics about, what works and what doesn't work? Which particular aspect of this app is not taken on board, by the citizens? Do we have Christian with us from the Commission?
We don't have any statistics apart from the overall download numbers which member states have provided or have reported. We are having discussions like Dick Willem and Dina and colleagues will know that we talk about this every week, and we share experiences, or they share experiences of the app as they've just done now. It's a difficult exercise to assess in quantitative terms. In a sense, even reaching one person through a notification who would not have been notified without an app, so that they can take appropriate action and get a test or quarantine themselves and their families, and alert their contacts, could be potentially priceless investment. So we need to wait and see how it all develops. The situation in different member states varies. In 2 or 3 member states, there are quite high levels of user penetration, 20, 30, 40%. In others, it's very low. You'll have noticed this week that in France, they've announced that they're relaunching their app because they've been very disappointed with the number of downloads. And they say that's partly due to the fact that they've chosen an architecture which is not supported by Apple and Google, which was the reason why a lot of fellow panelists here have explained that they decided to switch architectures. So yeah, we need to have a collective means of reporting on this, and that's important for us in the Commission, because we've delivered this solution for interoperability, and when people start moving around again across borders, and using the gateway, we'll be able to see whether or not it's having an impact on a European level as well.
Okay, very good. So I have a question, guys, from the panel. Dimitra just sent it to me regarding GDPR. Which is there were concerns about privacy, and how do you see the legal basis of these apps, with regards to GDPR. So how did you manage to address these issues, to resolve these issues? If we can go very quickly, make a tour, at least with the ones that have developed the apps. Dina, yes, I see you waving your hand.
So I just needed to unmute myself. So I forgot to mention, for example, with regards to privacy, I mean, we are not responsible for privacy, but in the whole development process, we also asked the federal commissioner for data protection and freedom of information. So our privacy data protection authority, and they were included in all those questions and were asked whenever there was any concern regarding privacy. And yes, in Germany we use the GDPR, and yes, we also tested the Federation Gateway Service, especially in that sense to confirm that GDPR is valid and that let's say German random keys are not somehow disclosed somewhere.
Very good. Excellent. So any other comments?
See, there are basically, I think it's completely correct that all member states are subject to the GDPR. So of course, all apps that are live at the moment are subject to and in accordance with GDPR. We have been in dialogue with our local Danish Data Protection Agency, and of course following also the European discussions very closely. Basically, there's been two ways of establishing the legal basis for the app. One is some member states have chosen the consent route, and others have chosen the legislative route. In Denmark, we very rarely use consent as a basis for government usage of data, because we cannot see that there's the equality in the relationship. So we almost always use the legislative route, which we've always done here. And basically, we have a basic law of epidemics, which says how do we handle epidemics in society, which are in accordance with GDPR. And then we have an executive order saying how is data handled, how do we keep this secure. This was, of course, due to the first major discussion saying, are the infected keys actually anonymized or heavily pseudonymized? And I think that the Danish position along the whole way has been that they're heavily pseudonymized. But the fact that they are so heavily pseudonymized makes it easier to lift the privacy by design requirements in GDPR when building the app. So basically, we've been very much aware of GDPR along the way, been in dialogue with our data protection guys, and also, of course, doing the impact assessment, both for our national app, but also for the federated gateway server. And so I think it's one of the best documented GDPR compliant products across the European Union, because a lot of GDPR people across the union have been discussing this very intensely to make sure that the apps as designed live up to the criteria, because it's so important for trust.
I mean, privacy is a very important, thing for the citizens, and the people who are into the privacy are very energetic, if I can use the term. Latvia, Eva, any comment on the GDPR thing in Latvia?
No, as I mentioned before, we did place a serious emphasis from the very beginning, including consulting with the president himself as a former judge on European Court of Justice and Human Rights. So we also obviously involved data protection, and I think we apply both methods in a say. We have a legislation behind it, like what is critical data and what is any information, what would require privacy in terms of GDPR, and what our data protection requires. So that's legislated. But on top of that, we still ask a consent of people, and then sort of ensures they also through this voluntary usage. And so I think it is a really good example, and I think it's really important that we are able to create on a state level a government product, because it is associated with a government service here that is trustworthy, because the erosion of privacy and trust in a digital realm is a very heavy, and I think it's important that we as a governments and institutions actually can provide an example and a solution, and also engage in a lot of discussions. We have had a lot of discussions here in public, be it social media or different other outreach to people to actually explain again and again as how it works. So I think it is. I agree with everyone. It's an important effort.
Excellent, thank you, Eva. And
could I just add, we do
Yeah.
not use the consent for the GDPR consent because we have the legislation, but we get a e-privacy consent because we store data on the people's phones. So we have a consent for the storage, but not the actual handling of the data. And of course, it's completely voluntary whether you want to use the app or not. So there are these 3 layers. There's the GDPR, which is legislative, but there's also the e-privacy directive, which requires consent, of course.
Thank you, Brigitte. So Christian, would like to add something. So please, Christian.
Yeah, well, before joining the commission, I was in the European Data Protection Supervisor's office for 6 years. So I thought deeply about this question in the first few weeks when there was enormous panic around the pandemic and also enthusiasm to try to use technology and data to do something about it. And personally, I thought that the big issue with this, with the idea of having an app for contact tracing, was not so much privacy. It was questions of social exclusion, stigmatization of people who get the virus, and potentially also a kind of society-wide risk of creating a social graph of who's in contact with whom. It's been compared to the sort of Cambridge Analytica scandal of 4 years ago, where it's not so much about individual privacy; it's about the impact, a wider impact on society of using technology in a risky way. But from a data protection perspective, and I think a lot of data protection authorities share this view, that if you cannot use personal data to combat a public health crisis and to save the lives of individuals, then what is the purpose of having processing personal data and having data protection rules? So it's important to put all of this in perspective. If you look at the documentation from April, it's not simply about data minimization and encryption and pseudonymization, very important though they are. It was also about the fact that we are doing something we're doing something temporary, and we're evaluating it, and we're considering all of the risks. And we're managing them in a responsible way.
Yes.
Yeah.
But I remember the story. It was around Easter time, and we were all under a lot of stress with a lockdown and everything. And then all this story with the apps popped up. So okay, let's be honest with ourselves. That was a bit rush, to prepare and develop these apps. And sometimes when we rush things out, we sometimes make mistakes. So were there any mistakes? Have you identified mistakes in the process of implementing the apps, and what did you learn? So from this. And what would you recommend, for others that they would like to develop an app, or they are considering, changing their existing apps? So, any honest participant? Dirk, maybe?
I can.
Yes, Eva.
I can. It won't be very technology. I'm more a policy person, so I actually would say I don't know if it's a mistake, any particular one mistake, but sort of anybody guilty in the mistake. But in a sense that we were struggling with all kind of messages, that interface messages, and it took us quite a time because we do not communicate with our people in English. So our people need a Latvian tailored messages, sort of even notifications. And that was a bit of struggle to me personally with Google headquarters, because part of those notifications that are related came from the framework. And those were initially like weekly notifications and some others. And the way they have framed it in English, it created confusion to people. I mean, mostly it said, you know, the system is running, exposure notification is on, and person immediately, he sees that and he finds alert, and the person calls the CDC, and CDC obviously doesn't know what's happening in the phone, right? So there was a lot of that interface that I found interesting because, you know, we were a local interface with people, but the headquarters, part of that notification system or the messaging was developed, you know, in Palo Alto, in Silicon Valley. So it felt, it took us a time actually to discuss that and come to common understanding what we need, because we are the ones, the offices on the ground who actually faces people's questions, and we can't really explain or change that.
Yes.
Just and to add to that, we found in the Netherlands that it wasn't just mere translations like internationalizations. It wasn't even sort of like localizations, like adapting to culture. It was fundamentally both with Apple and Google UI, UX, user experience issues. So fundamentally showing things at the wrong time in the wrong type of mode or something along those lines. So these were generally not discussions about just change the text somewhere, but really fundamentally about how those frameworks should sort of like behave differently. And we were slightly extra hit is that by the time this came to a head, Google and Apple were basically both sort of like pursuing different commercial opportunities, thinking about like dealing with the US, and really sort of like we're having a lot of situations where borderline, you kind of like have to ask sort of like whether this framework we're having there was actually even fit for purpose. I mean, it was sort of like that borderline. I mean, we wouldn't accept that in a like on the controls of a car or any sort of like normal sort of thing. So really that was for us sort of like a bit of an eye opener that how vital it was to not just sort of like control a few translations, but really like small things like the timing of something, or like that a message would come up at such a moment that it would likely spook people or panic people, even though the message was innocent, no matter what you did.
Very good. So Dirk, any other colleague who wants to contribute, you know, panelists?
I think that we very quickly established a very good international collaboration. But looking back, in a perfect world, it would have been even better if we had done even more knowledge sharing, again, because we were all using the same framework provided by Apple and Google. And I think that that a lot of us have actually spent time discussing the same things, where if we had shared information earlier, that we would have been quicker and to reach a sensible solution. But also the variation, especially when you look at saying, okay, what's the difference between the specifications from Apple and Google and the physical reactions on the phones, where we at least see a much greater variation on Android phones, because the producers have much more. There's a much bigger variation in the way the Android framework is established on the phones. So basically, this whole knowledge about what is the raw material we're working on with the phone, I think I personally start out with a rather naive view that if this framework is published, then it's trustworthy and stable and works, and basically an awareness saying that we need to monitor this constantly and keep an open dialogue saying how do we monitor the changes along the way and how it's implemented, and also make sure that everything works as it's supposed to. It might be banal for someone else, but I kind of say, okay, well, since it's published, it must be right.
Well, you know how it is, you know, so by regulation, as you said, you know, it is working well. So I give the floor to Dina, who wants also to express, you know, the German experience.
Yeah, thank you very much. I would like to refer to the rush in the development of the app and our experiences. So, and you were asking, for measures or what we would do differently. So first thing I have to say is, due to the rush, breathe. Just breathe. So when we started with the pandemic and it was wanted, and then, as I said, the need to create such an app, breathe and remain I will not say chilled, but remain a bit relaxed, because that was really a rush and really lots of effort in many places, and this tends to be uncoordinated. And what I would like to say is, in any crisis, so what is the first thing that breaks down? It's communication. So what we have seen here, it is very essential to communicate with all the stakeholders, to have a proper project management, and what is really on a technical basis, because I guess you're also asking me for that. So you have to find consensus on a certain design and architecture structure, and then you have to rely on that. And before you build such things, you have to consider IT security and privacy features. So this is, I mean, these are not necessarily things that we learned new, but that became really prominent during the whole process.
Yes, indeed. You are absolutely right. And that's the purpose of this session today, about security and privacy of the mobile tracing apps. The Commission, any lessons learned, from the colleagues from the Commission? Did you intervene too late, too early? Did you have the right scope? Were you able, to relate with the member states? Did you receive enough support from them or contributions?
Well, I mean, I'm very new to this community, in the eHealth network, where all of this work has taken place. But I've been amazed by the commitment. We've had meetings that basically took all day, sometimes every day of the week when it was at its most intense, so that it's been an illustration of how powerful it can be when policymakers and technical experts can come together in emergency circumstances. So I think it's proven. I think it's been a remarkable achievement. Lessons learned. Well, it has demonstrated the fact that public health is not a it may be a national competence, but a pandemic, by its very nature, is not restricted by borders. So, and particularly in the EU, where we have an internal market, where we have freedom of movement and so on, I think it's illustrated the fact that we need to build up a framework for cooperation on a practical level, like we've done in the last 6 months. Because this virus isn't going away soon, if it ever does. So we've always had pandemic in threat assessments, and it's actually materialized this year, and now we need to build on what we've learned. The Apple and Google element is something that we can't ignore. The fact is that everybody depends on them, because they control the mobile operating system for all of these smartphones. So there is, I think we've built up a reasonable working relationship with them. I think the announcement about the Exposure Notification Express at the beginning of September came as a shock to a lot of people, although they had actually said that they were going to do it back in April when they made their first announcement about the APIs. But clearly, it wasn't clear from what they said at the beginning of September that they were really targeting parts of the world, particularly in the US, where they just don't, public authorities just don't develop apps. They don't, and they've been way behind Europe in this whole contact tracing app exercise. So they were trying to give a boost to the states in the United States, but that didn't come across, and I think that's that's something to learn from as well.
Okay, very good. So, guys, we are almost at the end of the panel. We still have 15 minutes to go. Maybe that might be the last question. Let's see. So, do the member states work on raising awareness, raising towards EU citizens with regards to these apps? I mean, are there any campaigns at EU level? So, I remember you mentioned France as an example. something that went wrong, and they had to do a lot of awareness raising. So how do you promote this, guys? How do you make sure that the citizens are motivated to download and use? So we start with whom?
Canada.
Yes.
I can speak for Latvia, and I guess it is a lot of is local importance to get to the local people. So we work a lot, and I'm grateful to the private initiative. Is like this consortium who has put in the resource and effort, and in together we work engaging big stakeholders like retail stores, shopping markets, public transportation companies. Like we reach out to the companies or structures who would be the next level who would deliver the information, the message, the encouragement with restaurants and bars. And so all the different, in summertime we used a lot of culture organizations who run the events. So we're trying to partner up with other institutions that would be sort of where people go and gather. We will have publications now in the national airline information, also especially in the context that it's becoming now on European level, and I hope Latvian app will join also next week, the European. So we do a lot of on our own, like government and president and prime minister and ministers, but we also we try to engage a lot of partners as a social project actually to get, and actually companies, a lot of companies do engage and onboard and put their own campaign resources in, because they do see it as a common public good for their own business and for people.
Excellent, very good. Any other contribution from any other member state? So, raising campaigns, Christian.
Just quickly, I mean, we had a coordinated awareness campaign just last week when we launched the interoperability server, and so there's agreed Q&A and infographics hosted by the Commission's website. But we spent a lot of time. There's a meeting every week to look at communication aspects of the contact tracing apps. So yeah, we're stepping up our game on that as well.
Yeah, and I think that's generally, I mean, like speaking of this eHealth network, sort of like this collaboration between the European sort of like electronic health efforts and sort of like Europe, from a technical perspective, that is actually a really sort of like rather well working sort of like collaboration where countries truly help each other, not just for the European Federated Gateway, but also where we can discuss or sort of like reach out to each other directly after those meetings if necessary about very specific issues with some bit of Apple or Google or some security issue or a UI UX issue. So generally sort of like these things help, sort of like have been sort of like an incredibly sort of like positive experience. And you'd sort of like almost hope that these sort of like capabilities would sort of like become routine in these sort of events. And at some level, you'd almost hope that at some point, sort of like we not only have sort of like these coordination capabilities available, sort of like as member states collectively, but also kind of like a very small sort of like technical staff to sort of like, essentially sort of like take some of those issues and sort of like lift them to a higher level. Because quite often we collaborate in 1 or 2 or 3 countries together to sort of like solve something technically and sort of like only then share it and lots of things. But generally, sort of like those eHealth meetings have been a very positive affair, at least for the Netherlands.
Very good. So anybody else?
Yes, the communication, we have 2 different communication strategies. One is kind of the project communication, where we've been very much in dialogue, where our own project with the stakeholders, there's the dialogue there, but also with the eHealth network, which for those of our listeners or viewers who don't know this, it's a standing forum for coordinating the way we exchange health data and use health data across the European Union. Because despite it being a national question, health data is relevant in order to ensure the free movement of people across the union. So it was an existing framework, which actually helped it very much because people know each other from the beginning, but the intensity of the meetings and the amount of meetings was ramped up very much. So you had this very much enhanced the European dialogue, where we helped each other both on a technical and also on a more policy, saying what are the choices made in different countries, saying what is the way to use this new technology and how do we use it best in a situation that's new to all of us. Further than that, we've also been talking to people outside the European Union, but the European dialogue has been exemplary in this situation.
Very good. Any other comment regarding awareness raising campaigns and how to motivate the citizens, to download the app and use the app? No? If not, then, I will kindly ask each one of you to take a 2-3 minutes, time to somehow wrap up the panel from your perspective. Any closing remarks, anything that you would like to say, any advice that you would like to give to the Commission, how to do this work better next time? Any personal reflection, whatever you think is necessary, please, the floor is yours. And I see Brigitte is thinking very seriously, so I will give the floor maybe to Dirk, who seems to be ready, for an answer.
Well, actually, I was still thinking, but I think if I sort of like draw this to myself a little bit more personally, because in the Netherlands we sort of like had the government essentially reach out to individuals, critical individuals, then I think one of the lessons learned for me is that it is actually possible for a government to make a country scale app where privacy and security are actually really sort of like the first concern. And if you asked me that a year ago, I kind of like would have seriously doubted, and yet sort of like I've seen that happening, and there's virtually nothing sort of like I would, as an engineer, I would like to sort of like improve or make better about this app. So I'm actually very, very impressed that a sort of like a country construct, that's sort of like a government, which is always constrained in many, many, many ways, is still able to rally together in these times and then build these things, not just in the Netherlands, but also kind of like if I look at the other countries, if I look at the wonderful stuff Germany did also with the European Federated Gateway. Basically, if you look at sort of like Denmark, at Ireland, and so on, I mean, that is, yeah, basically that makes me very positive. It sort of like brings back some of the good things of the internet from the early days.
Excellent, Dirk. So very positive, very encouraging. That's the right tempo, to close the panel, for today in an optimismus. So next one, Eva. Maybe.
Yeah, I can take a floor. I can only share the positives, and I think it has been and it still is amazing project as we all kind of learn and move on. I think I'm really sort of, on a personal note, probably too, I'm really pleased to see that technology can apply more for society good, as from the government perspective. We used to think that it's a matter of convenience. You can manage easier finances. You can use maps. There's a lot of fun stuff that you can do with technologies, and I'm really happy to see that technology in such a crucial moment can actually be helpful and can be applied, and we can mobilize the best and the brightest sort of minds to work on it. A challenge for me that I'm taking that from this experience, and that may be more to my government, but is really the skill set that we were able to mobilize because of crisis, and the private sector was willing and interested to plug in. We clearly are lacking those skills in government side. I don't know how government can keep up with technologies and all the sort of thinking and options, and I'm really lacking that skill on government side. And I'm thinking of how this public-private partnership, or whatever you call, how we can in the future work better together based on this experience. So I think it's amazing experience that we learn, though the conditions or situation in general obviously is not the best one.
Thank you, Eva. Indeed, when there is a will, there is a way, and under pressure, people, tend to deliver. Unfortunately, it was the case. So, and we can all be very proud, of what is happening in individual member states, but also in Europe as a whole. It's a very, very important thing. We can say this at the end. The next, Dina, maybe, Brigitte.
Yeah, I can take over.
Yes, please.
So I'm really astonished, surprised, and really utterly happy that it worked out in so many states. Just to endorse with my with the previous panelists, that so many countries managed to get things running. My advice is better think a little bit more before than just start the sprint and the run, because especially in terms of IT security, you cannot add it in the end. You have to implement it from the beginning. So this is really one of the biggest things. So you really have to think before you plan, design, and create something. That is what I meant with breathing. Take your time, think carefully about it. Do you really want this? Or do you want it differently? Are there options? Think about different strategies. There is typically not only one solution to a problem, except in math. But the next thing would be communication. And what I said, project management and processes. So find the right processes, find the right teams, get the right partners whenever you have a problem in order to speed up the processes. I mean, you know, I'm working for a federal office, and it is very likely that information flow might take time, but we learned a lot, and it can be really fast when you have the appropriate and right teams together. So enhanced communication flow, define roles and yeah, let's say privileges. So apply IT security to your project management when you want to design a secure and proper application.
Absolutely, Dina. Thank you for reminding this important, lesson that, unfortunately, we were under pressure, to deliver the apps, but indeed, security cannot be added, it's not something that you can add, and if you want to add it, it's going to cost money and resources, and you have to then create new versions. So better think twice and implement it properly, and I'm sure that in all of you have done this in the best possible way given the circumstances. Okay, Brigitte, so you are the last of the
I have the privilege of running. I think this is a prime example of when agile development works, because when we look at it, we all had a shared problem, and we did not know what solution, and technology shifted along the way. But as to repeat some of the others, that internally in Denmark, we established a project team across different authorities, across both public and private, and I think that's something that's been seen in general across in different member states, that one actor could not deliver the solution on their own, but we needed to collaborate. And also both the European and the global collaboration has been exemplary, because we had this very clear goal of a shared problem. And so that's one of the things where when we look at it, could we have done it better? I agree. A lot of people have been improved to have slower breathing in April. On the other hand, we're all under a great deal of pressure in order to deliver results. But basically that once you have a very clear problem definition, then collaboration and using each other's knowledge and different views, we could all help each other improving the application. On the other hand, I think this is I think this is the one example where, when you look at the time to market, both from the national apps, but also for establishing a European shared framework and shared infrastructure, that's the shortest timeline in my experience of both national and European collaboration. So when you have this very clear goal, but also saying we want to get the results going and then keep up the continual improvement afterwards, then that's possible. So I think that might be actually one of the good things, saying, well, the established infrastructures, the established fora, they were robust enough to ramp up the activity to deliver a solution in this extraordinary circumstance. And I think the next time we have to collaborate on some kind of new technology, I would personally prefer a little longer timeline, but I would very much appreciate to reuse all the different connections and the way of doing shared problem solving which has been done in this situation, and which I expect will continue within in the coming months and hopefully not many years regarding the handling
Indeed.
of Corona.
Indeed. Thank you, Brigitte. And, Christian, the moment of truth, so you have to reflect, on whether the Commission has done its job properly and if you are happy, with it, and what would you recommend,
Oh, the Commission is always very happy with itself, but it's for the others to
Of
judge, I
course.
think. Seriously, I think three things that, personally speaking, I take from all of this. The first is that I don't think you should be afraid of the GDPR. This is what I used to say in my previous job as well. I don't think it's been that painful finding a way to apply this technology and to use personal data for the benefit of public health and individual safety. Second thing is I really think that we have laid the foundations with this exercise for future collaboration and the use of digital transformation in the area of public health, and it's going to be a major area in the next decade, I think, for Europe. And then the third thing is perhaps beware of kind of bullshit merchants. So there are lots of crazy ideas out there for just using technology because it's there. So there was a thing a couple of months ago where everyone was being lobbied about immunity passports. Extremely dangerous and unproven and probably useless, but with lots of risks. So this is what we've done with this exercise is we've really focused on something which has value, and Europe has been able to unite around it and deliver something very quickly, which is tangible. It's not just an abstract idea or a piece of law. It's actually it's a bit of technological kit which is potentially could save lives.
Thank you, Christian. Indeed, another positive note. I think we are closing this panel, with a very positive note, and I will say that was a big challenge for all of us, not only at the individual level as citizens being locked down, in our individual homes, apartments, and so on, teleworking, for months and weeks, but also, for the government officers like you, trying, to develop apps with a very short notice and under very difficult circumstances, trying to address difficult subjects like, privacy and security. So you can all be very, very proud. We can all be very proud of the end result. And if we can manage, to save even one individual, even one citizen, that makes our job, extremely important. So, and with this positive note, I would like to thank you from the bottom of my heart for this very good and interesting discussion. I hope, our audience liked it. It's already Friday, and I will give the floor back to Dimitra, to draw some conclusions and close the conference for today. So thank you again for all the very nice statements. Back to you, Dimitra.
Thank you so much, Vangelis. Thank you very much, everyone, for this wonderful discussion. I will try to wrap up and summarize what was discussed. First of all, because this is an open event that will be broadcasted and will stay the recording live to the citizens, I would like to say that the positive note is that all the member states joined together and collaborated successfully against the COVID-19 pandemic. So this was one way that technology worked towards supporting the European Union citizens and globally. So what the panelists told us today is that actually it worked. The COVID-19 tracing applications are working. We might not see the results directly. It was a very cumbersome activity to undertake. It took a lot of effort in a very, very limited time. And regardless of the architecture that was chosen, regardless of the deployment model that was eventually decided, the cybersecurity and privacy concerns were a priority for all the governmental authorities that were in charge of creating these applications. We saw this in very early stages when the European Commission issued the EU toolbox and they added the cybersecurity, interoperability, and data protection as the pillars of these applications. But eventually today, in the discussion that we had with the different member states, we saw that this was a priority from the very beginning for everyone. What this crisis left us is the need for collaboration, and actually not maybe the need, but the fact that collaboration works. So in these difficult times, the member states were together. They collaborated under an umbrella that might be called the eHealth network, under the European Commission toolbox for the applications. It doesn't matter how it's called, the community, but they collaborated and they all worked together. And regardless of the differences that each member state might have, we understood that we have a common cause, and this is to bring us all safe and sound against after this storm has finished. So I think the lesson learned out of this was very well stated from Christian. Eventually, this virus will go, but crisis might come again soon. So what this experience created is a very good framework, a framework for collaboration, a framework for protecting the citizens, and a framework for putting forward the correct priorities from the very, very beginning. So thank you all so much for being here today. Indeed, it's a Friday afternoon, and maybe we didn't see so many people attending the audience. Actually, we had a lot of questions. Please note and know that this will stay recorded. So questions might come again at a later stage, at a later point. For the rest of you, for our audience, please stay tuned. This was the second session of the series of the ENISA eHealth Security Conference. The third one will follow, and the last one in 1 month's time. So we have set the 23rd of each month as the eHealth Security Day. So the next one, the last one, will be on the 23rd of November, and the topic will be more technical. We will focus on incident response for healthcare, specifically during the pandemic. So how during the ransomware campaigns, during all the attacks that the hospitals and healthcare organizations received, how did they react? How were they prepared? And how did the European Union institutions like Europol and CERT-EU supported them in these activities? So stay tuned. Thank you so much for being here. Thank you so much, our esteemed panelists and moderator. And stay sound, healthy, and safe. Thank you.
Thank you.
Thank you. Bye.